Hi everyone, my name is Veronica Oliveros, and I am going to be performing a full body assessment on my patient Ben here. He is 39 years old, male. So starting with the general part, we're going to be assessing his appearance, his mood, his alertness, and skin color. So he is alert and oriented ×3. Appears to be well groomed. Skin color is normal for him. So moving on to the head and face, again, we're assessing the skin, making sure there's no abscesses, lesions, open wounds, any signs of infection. We are going to begin by inspecting and palpating the scalp. So you're just going to, look through the hair, make sure everything looks normal. Again, assessing, making sure there are no lesions or open wounds, and everything looks normal. So we're gonna inspect the face, looking for symmetry, his expression, and his facial features. So again, looking at it, everything looks pretty symmetric, and normal findings. So we're gonna be asking him to raise his eyebrows. We're gonna ask him to do it one more time. We're gonna smile. We're gonna frown, and we already had him do raising his eyebrows against resistance. This is testing for cranial nerve 5 and 7. So everything looks within normal limits, and normal findings. So testing for cranial nerve 5 for facial sensation, I'm gonna have him close his eyes, and then he will tell me when he feels the sensation.
Now.
Okay, so I would say those are normal findings. When I touched, he was able to tell that there was a sensation in that area. And then we are going to palpate and assess the masseters and temporal muscle. So bite down for me, nice and hard, so you're able to palpate the masseter muscle. You're going to open up and then bite down, and same with the temporal muscle. So that is normal findings. So moving on to the eyes, we are going to begin with the Resp test, which is also known as the corneal light reflex test. This is a test screening to assess the eye alignment and detect cross eyes. So what's going to happen is I'm going to fix the pen light medially. He's going to fix his gaze on the pen light. Normal findings would be reflection will be symmetrical and centered in the pupils of both eyes. So I'm going to go ahead and do that. Perfect. So you can see that reflection in both eyes bilaterally, so that is within normal limits. So the next thing we're going to do is the cover and uncover test. So what I'm going to have them do is cover one eye while I shine the pen light in the other eye, and we're basically looking for any involuntary movements. So you can cover one eye, good, and then the other eye. Perfect. So that was within normal limits. There were no involuntary movements. Okay, so the next thing we're going to do is we are just going to inspect for position, alignment. We're going to inspect the eyelids, the eyelashes, the lacrimal apparatus, conjunctivi, and the sclera. So looking at him, everything looks normal. There's no drainage. There's no signs of infection. Sclera is not red. There's no crusting on his eyelashes. There's no tearing or extra signs of infection as well. So that is within normal limits. The next thing we are going to be assessing for is cranial nerve 3 for Perla. So that is making sure the pupils are equal, round, reactive to light, and accommodation. So we will be shining the pen light again, making sure that the eyes dilate, and we're going to start with that. And then he's just going to follow the pen light. So that is, if you can see, sorry if I was covering. So that is within normal limits, and the pupils dilated. The next thing that we are going to do is the fundoscopic assessment using our ophthalmoscope. So we are going to shine this in his eyes and just take a look at the eyes. Perfect. So normal findings would be a red reflex bilaterally present, a yellow-orange color for the optic disc, and well margined. The retinal background should be even without any exudate or signs of hemorrhage, so his was within normal limits. And then last, we are going to check we are going to assess for the extraocular movement. That is going to be testing for cranial nerve 3, 4, and 6. So I'm just going to have them follow my fingers. So you're going to look up, that way, that way, that way, down here, this way, and then here. So he was able to do that perfectly, so that's also within normal limits. So moving on to the ears, we are going to expect for position, size, symmetry, shape, and make sure everything looks normal. Just on this side, so everything appears to be within normal limits. We are going to palpate the pinna and the tragus for any signs of tenderness. Are you experiencing any tenderness? No. Perfect. So that is within normal limits. Moving on, we are going to assess the ear canal with the otoscope next. So. So normal findings would be no signs of drainage, no obstruction, no excess cerumen, and making sure the tympanic membrane is either pearly gray or pink, and those are all normal findings. So we are going to move on to the Weber, Renee, and Whisper test. So the Weber test is essentially used to determine the type of hearing loss, whether it's conductive or sensorineural. Basically, a normal finding for the Weber test, you are going to hear the sound in both ears. If it was conductive hearing loss, the louder sound, you would hear it louder in the affected ear. Sensorineural would be heard louder in the unaffected ear. So we're going to start.
No.
Do you hear it in both ears?
No.
Sure.
No.
Sorry.
Yes.
Okay, perfect. So that would be within normal limits because he's hearing it in both ears. So the Renee test is essentially the same thing. It's just a different test. So we are going to be assessing for air conduction versus bone conduction. So
Yes.
let me know when it stops.
No.
Can you hear that?
Yes.
Let me know when it stops.
No.
So that is within normal limits, and basically it just shows that air conduction is going to outlast bone conduction, and that is what we want to see within normal limits. And then we're going to do the whisper test, so I'm going to stand essentially behind him at arm's length. I'm going to whisper numbers, and he is going to repeat them.
9, 7, 8, 5.
So he repeated that perfectly, and that is within normal limits bilaterally. Okay, moving on to the nose. So again, we're going to inspect for shape, symmetry, skin, make sure that everything looks normal, no signs of infection, no open lesions. We would palpate the bridge of the nose and soft tissue just to make sure that everything looks, and there's no tenderness and everything looks normal. We are going to palpate the sinuses, so we'll do the upper. Any tenderness?
Nope.
Perfect. So that is within normal limits. Somebody who has tenderness there or feels pressure, that may be signs of sinusitis or some kind of infection in that area. So we are going to inspect the nasal cavity next, just to make sure everything looks clear. Okay. Perfect. So again, we're just assessing for any obstructions. nasal deviations, and making sure that passageway is clear, moist, not irritated. So his looks good. If there is a deviation, obviously that person would be having a harder time breathing through one side of their nose. And then sense of smell, if I had either smelling salts or a alcohol swab, just to make sure that he could smell that, and that would be within normal limits. Moving on to the mouth. So again, we're going to inspect for symmetry, skin. We're going to make sure that there's no sores, open lesions, signs of infections, that he is able to smile symmetrically, smile nice and big. And then we are going to inspect the inside of his mouth. We are going to inspect, to begin with, inspecting the gums, buccal mucosa, the teeth. So you're going to just smile for me, good, and then open up, good. You're going to raise your tongue up, good. So inside the mouth, normal would be something pink, more findings pink and moist. The hard palate would be pale, soft palate would be pink, teeth white, clean, no odor or cavities, and if he does have cavities, making sure that they're filled, and he's seeing the dentist regularly. So all of that was within normal findings. So we're going to, and also making sure that there's no lesions on the tongues or open wounds as well. So testing for cranial nerve 12, we are going to assess the tongue movement and strength. So basically, I'm going to stand behind him, have him put his tongue to one side of the mouth, and perfect, and then the other side. And so by equal bilateral strength on both sides. If there was an asymmetry in that, or one side is less strong than the other, that could be a sign of something more serious, like a stroke or something, but his was within normal limits. We are also going to inspect the tonsils. You're gonna open up, making sure they're not swollen, red, any signs of infection. And then last, we're gonna test the gag reflex, would be cranial nerve 9 and 10. So, 9. So we're watching for the rising of the uvula, which his was, which is within normal findings. And then last, assessing for taste. If I had a hard candy, I would have him taste it, make sure that he's tasting correctly, which would assess for cranial nerve 7 and 9. So moving on to the neck, we are going to palpate the lymph nodes. Pretty much non-palpable. Sometimes they are movable. That would actually be within normal limits, but not non-tender. We are going to palpate the carotid pulses. Essentially what we're doing is making sure that we are doing one side at a time. Perfect. Perfect. So +2 is within normal limits, no signs of a bruit. We're also going to assess the tracheal position. So a slight deviation to the right would be normal due to the aortic arch, so his is within normal limits. We're also assessing the thyroid just to make sure it's not enlarged and it's palpable. An enlarged thyroid could be a sign of a goiter, but his is within normal limits. So what we're going to do is now auscultate the thyroid and carotid arteries. So let's do that. Perfect. Again, +2 within normal limits, no signs of a bruit. And then last, we are testing for cranial nerve 11. We're going to have him shrug his shoulders against resistance, and they are bilaterally equal in strength. So again, within normal limits. Okay, so moving on to the posterior chest, we would inspect the skin. Make sure, again, everything looks within normal limits, no signs of open wounds, lesions, or anything like that. So we're going to start with thoracic expansion. So I'm just going to have you slide that way a little bit. And going to have him take a deep breath in and out. Perfect again. And out. And so there is bilateral expansion of both his sides. The next thing we're going to test for is tactile fermentus. So just making sure that vibration is equal throughout the lung field. So you are going to repeat 99 when I tell you. I'm going to use, I can use the palm of my hand or even the side of this here. So
99, 99, 99, 99, 99, 99.
So his is within normal limits, no areas of dullness. That is normal. So we are going to start with the percussion of the lung field. So essentially what we're doing is bringing this down almost like in an L formation. And we are going to assess bilaterally. So there is no areas of dullness, which is within normal limits. If there was, that could be signs of obstruction of airflow, which would be indicative of some lung disease, bronchitis, things like that, pneumonia. So moving on to diaphragmatic excursion, and that's basically testing the distance of the diaphragm between it moving up and down during breathing. So again, we're just going to have him take a deep breath in and out, and we're going to percuss the area until it's dull, and then we would mark it with a pen, and then ask him to take another deep breath in and out. And basically a normal finding would be anywhere between 3 and 5 centimeters. So next we are going to also take the lung sounds, and just have him take some deep breaths in. Good. And you're going to do that throughout the lung field, making sure there are no abnormal sounds. His sound clear bilaterally throughout his lung fields. So now we're going to assess the anterior chest. Same thing, testing for shape, assessing for shape and symmetry. We are testing for the thoracic expansion and palpating. So I'm going to have you turn, take some deep breaths. Good. And then we are going to assess his respiratory rate. So that's just taking his pulses bilaterally. Normal would be anything between 12 and 20. And then we would also assess his lung sounds here. Just normal breathing. And we would test this bilaterally throughout his lung fields. And there is no, it sounds within normal limits and clear throughout his lung field. So moving on to the heart, we are going to auscultate the heart sounds in the different areas. So we are going to start with the right sternal in the second intercostal space, which would be his aortic. Perfect. Right across from there is the pulmonic area. Moving down from there is basically is Erb's point, which would be in the third intercostal area. Moving down from there, and the fourth would be the tricuspid, and then in the fifth intercostal area would be the apex. And so a regular heartbeat would be anywhere from 50 to 100. Anything less than 50 would be considered Brady. Anything greater than 100 would be considered tachycardic. We are going to assess for jugular vein distension, so he's going to tilt his head back and turn that way, and there's no signs of distension in the jugular vein, so that is normal. Last, we are going to inspect and auscultate the aortic, renal, iliac, and femoral arteries. So the aortic would be slightly above the umbilicus. The renal would be basically across from the umbilicus. The iliac would be slightly below that, and then the femoral would be in the groin area, which we would inspect and auscultate from there. I would likely have him laying back just to have better sounds of that. And last, we are going to inspect and palpate the upper and lower extremity pulses and circulation. So we would start with the brachial pulses bilaterally, same thing with the radial bilaterally, and then the posterior tibial pulses and the pedal pulses bilaterally. So we're basically assessing, making sure that they're not bounding, thready, and there's a even flow going throughout them. His were within normal limits, and that concludes our assessment. So have a good night.